Hey guys, welcome back to my YouTube channel. Today we're going to be talking about phlebotomy for my oral communication class. Phlebotomy, this is going to be an informative presentation. Phlebotomy is all about drawing blood, though it can include other things, but it's primarily venipuncture of the antecubital fossa, which is venipuncture is just sticking a needle into this part of your arm. Before I want to get into it though, just want to introduce you to this fun little fact, which is that this is the barber pole. Everybody's seen this, everybody recognizes it, but there's an actual significance behind it that has something to do with phlebotomy, which is that way back then, bloodletting was a common practice where people would basically intentionally cause someone to bleed so that they could bleed out a disease or a fever or something like that. The idea was that this was actually a good thing when it actually wasn't. And so barbers, since back then, barbers cut hair, and so cutting hair involves using sharp objects, since they had expertise with using sharp objects. So barbers actually partook in that, and so it represents the colors represent exactly that. The red represents the color of blood, the blue represents the color of the veins, and the white represents the color of bandages. So a little bit about how I want to structure this. I'm going to structure it in three main parts. What is phlebotomy? How to draw blood, how not to draw blood. And then for the middle one, how to draw blood, I'm going to structure it with a before, a during, and an after. First, what is phlebotomy? Ignore the rest of this definition. I want you to really want to focus on this. This is kind of not so important. So phlebotomy is the consensual process of drawing blood from an accurately identified patient to the corresponding containers. It can include other things. I want to talk about a couple things with this. One is consensual. It has to be consensual, unless or else it is battery. It is a crime. You can get in legal trouble. You can get in trouble with your employer, that sort of thing. So you have to acquire consent. And we'll talk about that a little bit. Another thing I want to look at in this definition is an accurately identified patient. So the idea is that the worst mistake as a phlebotomist you can make is misidentifying the patient or not identifying them all. We'll talk about that later too. Corresponding containers, there's really only two containers you can draw blood into, really. That's blood cultures and then these blood tubes. Though one thing I want to note with this is that phlebotomy does not only, it can include other things other than blood. It can include the collection of other things such as urine and semen, but it's primarily, again, venipuncture of the antecubital fossa, this part of your arm right here. You can mistake from other places though, such as your finger, your hand, this part of your hand, and your heel for infants, that sort of thing. There's three settings that phlebotomy can take place under. Hospital, this is where you find people of all ages, of all, sick, healthy, whatever. Blood donation, this is where people only of a specific age and a specific being healthy, a certain weight, that sort of thing. In the home setting, phlebotomists can drive to the home of the patient if the patient can pay for it, or if just because the patient has trouble getting to the hospital, and they can do it there. So how to do it, this is kind of like a before part of how to do it. This is your checklist. First, you need a physician's order. You can't do it just because you kind of feel like it. Second, you want to wash your hands when you're walking into the room or before you walk into you have to wash your hands. It's kind of common sense. Also, you need your personal protective equipment. This is required. Personal protective equipment can include just simply gloves, or it can include a mask, it can include two masks, it can include all kinds of things. You want to gather your materials, and we'll talk about that in another slide. You want to identify the patient. I'm also going to talk about that in another slide. You want to explain the process in just one sentence if you want to, which is, hey, my name's so-and-so, and today I'm going to be drawing your blood. That kind of captures the whole thing. Then you want to acquire consent. Again, we're going to talk about that in another slide. And then check allergies. So you also want to ask them if they're allergic to either A, latex, or B, alcohol, because we're going to be wearing gloves that are made of latex. And then the antiseptic we're going to be using is also very alcohol-based. How to do it. These are types of consent. There's really three, I guess, four. Informed and expressed are similar, except for the fact that informed is a little more informed. You're a little more aware. Implied is kind of like in this example, them holding out their arm. When you say, hey, I'm here to draw your blood, and they hold out their arm and show it to you, that sort of thing. Parental consent for minors, obviously, is also self-explanatory. Patient identification, so you need two forms of identification for the patient. One of the possible ones you could use is this little bracelet. There'll be, if you're in a hospital setting, on the patient's arm. It has to be on the patient. Like it says here, if it's on the bed rail or in the pocket, it is void. And the idea is that you scan it, the barcode, with a little machine, and it'll show up on a computer screen the information you're looking for. And there's other ways also, so you can ask the patient, hey, spell your first middle name for me, tell me your date of birth, tell me your last 4 digits of social security, those sorts of things. But the idea is that you can't ask yes or no questions and you want their identity. This is the materials you're going to be wanting to have going into it. Personal protective equipment, already went over that. That's just gloves, mask, whatever. Tourniquet to tie it onto the person. Tape, this is the tape and cloth bandage are together, so after you pull out the needle, you want to play some cloth on it and also tape to hold it there. Tubes, whatever tubes you need, you're probably not going to use all of these tubes. This is the order of draw. In the order of draw, the idea is that you have to go in a specific order. You have to go in this specific order, and of course you're not going to be using all of these, so say if you only this, this, and this, and then you'll just skip around in that order. Where was I? And then needles. So there's really 2 types of needles for venipuncture. There is the straight stick, which is this, and there's the butterfly, which is this. Straight stick is more so for venipuncture of the antecubital fossa, again in this region, and the butterfly needle is more so for the hand or other situations that merit it. Antiseptic, so you also need antiseptic, something to clean the site. You want to be aware of where the needle's bin is, which is where you're going to be putting the needle after you cap it and put it in there. And then also sometimes for certain tests with certain tubes, you'll need special containers for the blood after you draw it, such as you might need to put it on ice, or you need to put it in a bag that blocks out light. So this is the how to do it, starting the blood draw. Before I talk about all of this, I want to focus on this. There's really 3 veins that they tell us and they teach us and they tell us to draw from. There's also, just like how there's an order of draw with the tubes, there's an order of draw with the veins, which is that you want to prioritize drawing from the median cubital first, which is this that descends from the basilic. Then you want to prioritize the cephalic second and the basilic third. Obviously, your goal is not to draw from each of these in one sitting. Obviously, the idea is to draw only from one of them, and if you can find it, you want to prioritize this and over that. The idea of the basilic vein, drawing it last, is that the basilic vein is, because of where it's located, it's the closest to the brachial artery, and the idea is that though the likelihood of you hitting the brachial artery is very, very low, it is technically the most dangerous for that reason. So for the step process of how to do it, once you're actually doing it, you have everything else done. So first you want to tie the tourniquet rather tight, 3 to 4 inches above the site of entry. It's going to be uncomfortable, but that's how it's supposed to feel. Then you want to palpate, which is kind of flicking for the vein, flicking the skin, and feel it for the vein that you want to use. Then you can either do one of 2 things. You can either untie the tourniquet and then wait a couple of seconds and then continue, or you can continue right from there. The idea is that you're only supposed to have the tourniquet on for a minute max. And so the reason why you might want to untie the tourniquet after you find the vein is so that you can reset the clock and then go back at it again. Or if you're fast enough and you feel confident enough, you can continue from there. The idea is once you are going to go do that, though, once you're going to stick, you want to clean the area first with an antiseptic. And then if you untie the tourniquet and tied it back, you want to also feel for the vein to ensure that it didn't collapse. You just want to ensure that it's still there. And then once you're actually doing it, you want to pull back on the skin with your other hand, your non-dominant hand, and with the bevel up, you want to insert at a 15 to 30 degrees angle going with the vein's direction. You don't want to go too far in, you don't want to not go far enough. For that, though, you kind of just have to get a good feel for it. And then with your other fingers that's not holding the needle, you want to grip the forearm, like the underside of the forearm, so that you can have stability for when you're inserting and removing the tubes. This is the ending the blood draw. So first, you have to remove the tourniquet first. Otherwise, if you remove the needle before the tourniquet, there's still pressure being applied to that vein, and that pressure is going to cause it to probably squirt out. So you remove the tourniquet first, then you want to remove the needle, cap the needle, and then immediately simultaneously while you do that, you also want to apply the cloth bandage onto the site, while also applying tape over the cloth bandage so that it stays in place, and applying a little pressure. And you also want to invert your tubes. This is the last slide. So this is how to not do it, 3 or so common mistakes. The first one says incorrectly identifying patient. Again, this is the most fatal mistake you can make as a phlebotomist, which is that if you misidentify the patient, what can ultimately happen as a result of that is that it's the wrong person, so they get their blood work done for the wrong person, and then the physician will order or prescribe the wrong medication because, again, it's the wrong person, and then this person gets medication that they don't need, and it could be medication that could kill them. So this is the worst mistake you can have. Make sure you don't do that. Premature needle withdrawal. This can happen for a couple of reasons. This can happen in terms of fishing for a vein. So fishing for a vein can cause premature needle withdrawal. Fishing for a vein is kind of this term that we use for when you insert the needle and you didn't hit a vein, so you kind of like pull it out and push it to the right or left to try to find the vein anyways. You're not supposed to do this, and doing so can cause premature needle withdrawal. Blood coagulation. This is just a fancy word for saying the blood clots in the tubes at some point after having drawn it. This can result for a variety of reasons. And then last but not least, again, you're only supposed to have the tourniquet applied for 1 minute max. And so if you have it longer than that, then you're not supposed to do that. So don't do that. And that's it.